Okay, now I'm going to talk about muscle control during the gait cycle. It's very important to remember during the gait cycle is to think about whether a muscle is acting concentrically or eccentrically. The question to ask yourself is the muscle controlling a forward momentum, or is it controlling the body weight against gravity, in which case it'd be acting eccentrically, and there's a lot of eccentric activity in gait, or is it bringing something forward or straightening up against gravity, in which case that would be a concentric activity. Okay? If you can think about what's actually happening, it'll be easier to remember what's what. So coming out of the swing cycle and going into the stance phase, right before that heel strike, you have the hip extensors. That's gluteus maximus. That's your biceps femoris. That's your semimembranosus, semitendinosus. You also have your abductors, so gluteus medius. And you also have your quads, the vasti group, and the rectus femoris. They're all going to come on just prior to heel strike, eccentrically. Okay? Why is it eccentrically? They're controlling that momentum of the swinging foot, and they're ready to control the momentum or the weight of your body. Okay? So they're all going to come on right before heel strike. At heel strike, now the hip extensors, which as I said is going to be both the hamstring group, gluteus maximus. It will also include some of the adductors, which are going to act like hip extensors. They're all going to be active concentrically to make sure that you stay up, okay, to stabilize you with the trunk. Otherwise, you would jackknife. The hip abductors, the gluteus medius, that's going to be on too to keep you upright in a concentric fashion. The vasti group, okay, the knee extensors, and probably the rectus femoris as well, they're still going to be active, but still eccentrically, because what happens when you go into the stance phase, you have a little bit of knee flexion, and as you go through the loading, foot flat, that loading response, your knee is still flexed. So your vasti group is really active eccentrically to keep you, to kind of cushion that weight, all right? And then, so the hip extensors, they're going to be active through that first part of the stance phase, basically through about foot flat. Okay, and then as you get to mid-stance, you're going to kind of start to tail off. The gluteus medius is going to be active all the way through stance phase, so heel strike, foot flat, mid-stance. It's not going to start to tail off until you go to the heel off. And the vasti group is going to be active from that heel strike, again, eccentrically, up until mid-stance when it goes concentrically to hold you up. So as you go into that stance phase, you take the step, your vasti group, you're bending your knee a little bit to kind of cushion that weight, but then you're going to straighten up. All right? So just quickly reviewing, right before heel strike, all your hip extensors, your abductors, your knee extensors are all going to go on eccentrically to be ready to cushion that weight. And then just before you step on, concentrically to kind of pick you up, except for the vasti group, which is going to stay eccentric until you get to mid-stance, when it's going to kind of straighten you up again. Okay? After you get to mid-stance, okay, what's beginning to happen? You're beginning to shift your weight, okay? So a lot of the muscle activity begins to kind of tail off. At this point, as I'm coming forward, I'm going into extension, and so iliopsoas, statatorius, and the rectus femoris, and some of the adductors, they're going to be active as hip flexors, but eccentrically, because I'm going into extension. So they're controlling this momentum, all right? But then they're going to turn around and go concentrically to pull me into swing, okay? So up into, so hip flexors don't really become active until after mid-stance. As you go through mid-stance, they're going to come on eccentrically to control this momentum of the femur, but then to go into swing phase, you're going to be concentrically to pull it forward, okay? And generally the flexors are thought only to be active through that first, maybe the early swing phase, because once you get to the early swing phase, it's kind of gravity that kind of takes you through the rest of that swing phase, okay? And then as you finish the stance phase, the gluteus medius is going to come off too. And why is that? Because your weight is shifting, okay? So as you go into that swing phase, your weight is shifting to this side, and that other group of muscles is going to be active, okay? At the ankle, okay? So at heel strike, you have eccentric activity of the anterior tib because it's going to lower the foot to the ground, okay? And then, once the foot is lowered to the ground, you're going to have eccentric activity of the calf group, soleus and gastroc, to control that movement of the tibia, okay? So once you once you come down, once that foot is down, the anterior tib is done, and now you have to control that momentum of the tibia coming forward, and that's going to be the gastric and the soleus. So that's all eccentric activity, all right? But then as you finish off that stance phase, as you go into what people call push-off, push-off is not an official phase of the gait cycle. It's commonly, it's basically a term used to describe that part between heel off and toe off, right, when your foot is actually pushing off. So that calf group, they're going to eccentrically control the tibia and then go concentrically to push off, right, because you're going into plantar flexion, all right? And then as you go through the swing phase, your anterior tib is going to be active just to keep your foot up, okay? So at the ankle, right, anterior tib is going to be eccentrically active to lower the foot, and then your soleus and gastrocnemius, your calf group, are going to be eccentrically active to control that tibia coming forward, and then they're going to switch to concentric activity to push off, and then the anterior tib is going to be concentrically active just to keep your foot up. At the subtalar joint for pronation and supination, as the foot comes down into heel strike, okay, the posterior tibialis begins to, your foot is actually everting, right, because you want that soft foot for the weight, but actually that's your posterior tib controlling that, okay, so that's eccentric activity. And the posterior tib is going to stay on all the way through the stance cycle, basically, almost. As you go down, it's going to eccentrically control that, that pronation or that eversion, and then it's going to turn around and become an inverter. Okay, so as you go through mid-stance, you switch from everting to inverting, right? And that's the posterior tib going from eccentric control as you evert to what it normally does, invert, that's concentric control, right? And that's the posterior tib. And then just generally speaking, your external rotators, like the gemelli guys and the short external rotators, they're active kind of through early stance. And internal rotators, in terms of muscles, are generally going to be active through the rest of stance. So from the beginning of stance for most of it, but external rotators is kind of that beginning. And that's muscle control of the gait cycle.